Hi, I'm Claire, one of the diabetes nurse specialists, and my main speciality is dealing with young people's diabetes. So I look after the patients 19 to 25-year-olds with diabetes. So when you first come from the Children's Diabetes Clinic up to the Manny Cousins Centre, you'll come in to our centre in the Beckett wing. As a specialist nurse for young people, I have lots of different roles really. I am in all the young people's clinics apart from when I'm on holiday, and one of my colleagues will be there. So I'm there in clinic. So when you come for the first time, we give you an introduction to clinic. We give you the contact numbers and a leaflet telling you about the clinic. We have a dedicated mobile phone for 19 to 25-year-olds. It's not out of hours, it's Monday to Friday, 9 till 4:30. But it means that you can always get hold. It's usually me who carries it, so it will be me, unless I'm on holiday, who'll pick it up and answer any questions. But then I can also see people in between appointments. So sometimes the doctors ask you to come to clinic every 4 months. But if you're struggling with anything or you need a bit of a hand with various things, I can see you every week, every 2 weeks, every 3 weeks, every month. And actually quite often I have quite a few people coming back on a monthly basis just to touch base and make sure they're still doing okay. Because it's that transition, that 19 to 25 is quite a difficult time. You might be leaving home, going to university, starting a new job, moving into a flat on your own. So it can be quite a tricky time. So it's just nice to have a friendly face to help you through that. Also, we run, I think I've said already about the Daphne course, we run a course for people with diabetes. It's all ages, but it's for people with type 1 diabetes, and I run that. When you come for your first appointment, it's a little bit scary because you might be used to coming to the children's clinic all the time, and some people don't know whether to come with the parents or whether to come on their own. And what we try and do is we try and make the waiting room as friendly as possible. So we try and have not very many other clinics running on the day where we have the young adult clinic. And we try and make the clinic as young adult friendly as possible. So we don't have the television on. We try and always have Radio 1 on. We try and have some, or we do have some teenage and young adult friendly leaflets available. And also I'm really conscious that people do feel a bit intimidated when they first come to clinic. So I'm always dotting about, and usually once I've met you once, I always remember you. So usually I'm catching up with you for a bit of a gossip. And when I mean a gossip, it's very rarely about diabetes. 9 times out of 10, it's about fashion, sports, what festival you've been to or whatever. So we very rarely talk about diabetes when we're chatting. So we try and make it as friendly as possible for you when you come to clinic. I've been dealing with young adults for the past sort of 18 years whilst I've been specialising in diabetes, and I think the biggest thing that people tell me is that they don't want to be different. So it's about if they're going out with the friends and they're going out maybe to McDonald's or Subway, or they're maybe going out drinking, that they have to think about what they're eating and inject, and they don't really always like injecting in front of the friends. So I think it's just that young adults don't like being different. So we just try and make it as easy as possible. We run a Daphne course, which isn't specifically for young adults, but it's for anybody with type 1 diabetes. And it's about trying to normalise diabetes wherever possible. So we can't make your diabetes go away miraculously. I wish we could. But we can try and make it as easy as possible and try and make it easy to fit in with your life, be it sports, drinking, going to festivals. We're very open-minded. We don't make any judgments. We encourage people to check the blood sugar so that they know how much insulin they need to be giving, and to make sure they're not going hypo, having low blood sugars. And again, it's fairly discreet. A lot of the meters tend to look like a mobile phone or an MP3 player. So you wouldn't really know what somebody was doing unless you knew what they were doing. It is a little finger prick, and a little bit of blood goes on the stick. takes 5 seconds and the blood glucose result comes up. And the meters have a memory, so you don't have to write anything down or make a big song and dance of it. And we teach people what to do with the results. Everybody's bound to be a bit nervous coming to a clinic for anything when you don't know what it's about. But I like to think that we're a really friendly clinic. We try and make people feel really welcome, from the reception staff who have worked here a long time and they're really approachable and know the ropes, to the healthcare assistants who call you through and do your weight and blood pressure, and the nurses and dietitians. Nobody judges anything. It's not school. We're not here or paid enough to tell you off. It's about helping you and making life as easy as possible, because we appreciate how difficult it is. My philosophy is that I think I just try and just help people. I can't make it go away, but I can try and make it as easy as possible to live with.